I'm Sophie Scott. Welcome to Health Watch. It's the leading cause of blindness in Australia, but most people don't even know the symptoms. Macular degeneration affects 1 in 7 people over 50, and every year nearly 18,000 new cases are diagnosed. Smokers and those with a family history are particularly vulnerable, but you don't have to be a smoker or be in a particular age group to get it.
Anastasia Palaszczuk, Queensland's Minister for Disability Services, was just 34 when she was diagnosed with macular degeneration.
I was completely shocked. I just could not believe that this was happening to me.
It's the first time the 40-year-old has spoken publicly about her condition.
It was just this black blurry dot and I kept rubbing my eyes. It wouldn't go away. I thought it might have been computer strain, reading too much.
A national survey commissioned by the Macular Degeneration Foundation last month found almost 90% of Australians aged over 50 don't know what the symptoms are.
Any disturbance with your vision, even if it's glare, difficulty with reading, any spots in front of your vision, anything is important.
Dr Beaumont says many people who have symptoms often dismiss them, thinking they've got a cataract or need glasses. Age and smoking increases your chances of getting the disease, but like Anastasia Palaszczuk, you can still get it regardless.
We want people to know that early detection is critical to saving sight.
That's certainly the case for the Queensland MP. 6 years after being diagnosed, the sight in her right eye is now almost the same as her left.
I do have some depth perception, so don't ask me to pour you a glass of water because it'll be only half full.
In some cases, a simple medical procedure can help restore eyesight. If left undetected, you could lose it altogether. Rebecca Barrett, ABC News.
There's been a major breakthrough in the quest to create artificial life. Scientists in the United States have used computers to create a synthetic cell that grows. Some say it's a world-changing event. They're comparing it to the splitting of the atom, but others are urging caution.
It's life with a difference. Scientists in this Maryland lab have developed the world's first synthetic living cell that's able to be replicated over 1 billion times.
The only DNA in the cell is the synthetic DNA that we made. So it's the first species on our planet to have its parent being a computer.
Here's how it was done. The creation of the synthetic cell began on a computer. Using just 4 bottles of chemicals from the lab shelf, the scientists built the DNA chromosome from scratch. They then inserted it into an empty bacterium. The man-made DNA replaced the natural DNA to become the world's first artificial life form. And when it reproduced, its offspring also had the new synthetic DNA.
This is a world-changing moment. I think it's a landmark moment. I think it's going to open up the most extraordinary possibilities for biotechnology and for how we use microbes and other organisms to produce things for us. It's the start of potentially a third industrial revolution.
Scientists say this technology could produce new vaccines or fuels, or be used to create biologically based electronic parts. It could also, for example, be used in an oil spill. Synthetic bugs could be created, which would clean up the oil quickly. But some are urging caution.
This may allow us to make more virulent viruses. This could unleash a bacterium on the world that has properties we didn't expect that could cause great disease.
For the first time, humans will be truly playing God. They will be creating life according to their own designs that could not otherwise naturally exist.
The one thing both critics and supporters agree on is that this tiny cell will have an enormous impact on our world. Anita Savage, ABC News.
And there have been 3 recorded cases in Australia of a stomach bug that's caused thousands of deaths overseas. Health experts say the possibility that it might spread is a real concern. We'll keep on top of that story for you. That's all for Health Watch. See you next week.